I think every dentist tries to find a speedier way to do things. I gave you the example of implants. When we first started putting implants in, we had to wait 6 months before we could load them or put a crown on them. We're now down to 4 weeks. So a lot of science has helped us in that area. Um, the second thing is we started off feeling we had to have so many implants to replace teeth that are missing. Now we find we can use less. So there's a lot of ways of making things go faster, but you've got to be very careful of going too fast and then paying a price for it. And it just takes, there's some practitioners that are comfortable with a fairly high failure rate. They just consider it part of it, but because they're not charging as much, they accept it. And there's others that just one fail problem is upsetting to them, and you know, they don't sleep at night and it bothers them and whatnot. So they're really going to try to do things as conservatively as possible. I think age is part of that too. I think as you are a more mature practitioner, you realize that it's okay to wait that extra week, it's okay to wait an extra month, whatever it's going to take, because predictably you're going to get a better result overall. Can you every once in a while push it and cut corners? Yes. But the body still needs, it has its timetable for healing and for doing things. And we're constantly trying to shorten it, but many times it's just the time it takes. If I extract a tooth, I have to wait for the body to fill in new calcified bone. How much time is that going to take? Well, it may vary from person to person, but generally there's a set time. And we can't decrease that by half or 2/3 because that's what it takes the body. But if you try something and it isn't working, you pay a price for it. You start to have more failures, or God forbid, you've put in the implant, a crown's been put on, and then it fails. And you look back in your records and you go, well, that was the one that I was trying to, you know, get done a little bit faster. So the difficulty today is knowing yourself well enough and knowing where you can push a little, where you can cut a corner without increasing your failures. And where is it better just to say, take your time, it's going to work. I know you're in a hurry to want to get it done, but I would say most of the time an implant and a crown can be done in a fairly short period of time, and some of the more elaborate type of problems can be as much as 6 months to a year.